Hi, Covington Veterinary family. This is Doctor Chobot here, and I just wanted to answer your questions about what to expect for your dog's spay.
What is a spay surgery for dogs?
Yeah, a spay surgery, as Kenzie knows, is actually removing the ovaries and the uterus. Is a total hysterectomy, and that means that your dog won't have a heat cycle anymore and won't be able to have puppies.
Why should you spay your dog?
Yeah, there's lots of reasons to spay your dog. The first is there is a overpopulation problem. So you can just check out Animal Care and Control and hope and see that there's plenty of extra puppies and dogs to be adopted. So we don't want to contribute to that problem. Also, it's healthier for your pet to be spayed. Yuckins. Because having the spay done reduces risk of mammary cancer, but also no risk of ovarian cancer and infection called pyometra, where there's an infection in the uterus, which is pretty dangerous and expensive surgery.
Okay, and what are the risks of spaying your dog?
The risks of spaying your dog, really, it's pretty minimal. Certainly they can have infection at the incision site, but that's pretty minimal risk. The biggest risk is, for most dogs, is weight gain. So when we do the spay, we remove the ovaries, and that reduces estrogen, and reducing estrogen slows down their metabolism, so they'll often gain weight. Other risks, some females, small percentage, as those estrogen levels drop, it reduces the urethral sphincter tone, so they may develop urinary incontinence when they're sleeping, but that's easily managed with medication, and it's not a very frequent occurrence.
What age should you spay your dog?
Yeah, my typical answer is 6 months of age. For most families and most family pets, that's a great answer. They are through their rapid growth phase by that point, and their baby teeth should have fallen out. If they haven't fallen out, we can help those baby teeth come out now so that they are not producing periodontal disease. But then the answer is not that simple for large breed dogs. Sometimes you may consider waiting to spay them until they're 2, but that also makes the surgery a little bit more technically difficult and a little bit more risky for your dog because there's a larger uterus with bigger blood supply, and it may cost more in that case as well. And you may not want to have to deal with the hassle of your dog going through 2 or 3 heats before getting them spayed. So that's really a personal choice that you can make and we can discuss.
And what does the spay surgery include?
Yeah, that spay surgery, we do recommend that you do pre-surgical blood work. That's going to check their blood counts and their organ function to make sure that they're a good candidate for the spay surgery. We do place an IV catheter and run fluids. They get pain medication in multiple forms, injections of anti-inflammatories, they get opioid pain medication, they get lidocaine blocks, and they have cold laser therapy, all in the name of reducing pain. They are on a heated water blanket to help keep them warm. We are monitoring their anesthesia with multiple parameters and a technician dedicated to monitoring their anesthesia. The veterinarian is going to scrub in a sterile gown and gloves and have a sterile pack, and the dog's abdomen is clipped and shaved and sterilely prepped, so the whole surgery is sterile. And then we go ahead and do the surgery where we remove the ovaries and the uterus and then close that incision with sutures. And then that patient is monitored in recovery. The abdomen is lasered, so they have less with cold laser to help reduce pain and speed healing. And then they are dismissed later that afternoon with some good pain medication to go home with.
What is the spay surgery recovery like?
Yeah, the spay surgery recovery is something to be prepared for. So the first thing is they need to be wearing some protection from licking at the incision. The biggest concern we have is for infection at the incision if they put the bacteria from their mouth on the incision. So preventing licking with an e-collar, an inflatable collar, or a surgical recovery suit, those are all really great options to prevent your dog from licking that incision. You're also going to want to keep your girl quiet for about 7 to 10 days. We want the surgery site to heal really well. And so that means leash walking outside to go potty, no rowdy play, no crazy times. We would prefer them to not be jumping up and down off furniture. So just a good amount of rest and relaxation. And that can be hard for young dogs that are full of energy. So you may want to do extra food enrichment like a frozen Kong, a lick-it mat, a snuffle mat, and extra long sniff walks So they're enriching their brain, but not using their body as much so it can heal. If you have any further questions, please feel free to contact Covington Veterinary Hospital. We're happy to help you.